Good morning, good afternoon, good evening, wherever you are in the world, whichever time zone you are on, a very warm welcome to this, the launch of the Legatum Institute's United States Prosperity Index 2020. I'm Michael Gillen and I run the Institute's International Events and Engagement Programme, and it's my great pleasure and privilege to be hosting this webinar today. Here at the Legatum Institute, our overarching ambition is to create pathways from poverty to prosperity for individuals, communities and nations. To achieve this, we've spent the last 14 years developing our expertise in tracking, measuring and analysing what makes countries prosperous, and then working across the globe to bring together experts and policymakers and formulate data-driven policy responses. Our United States Prosperity Index is a key part of that transformational product suite. Launched last year at the American Enterprise Institute and in partnership with the Brookings Institution, the index is a holistic and comprehensive measure of how prosperity has been evolving across the 50 states of the Union and Washington D.C. Now in its third year, we have really high ambitions for this work. America, as elsewhere, is at a crossroads. Now more than ever, we need an objective means of considering how the US might emerge more prosperous from the present health, social and economic challenges. Using this index, we believe we can unlock effective policy responses and create pathways to prosperity that will genuinely advance the American dream. So that's a bit of background on who we are and what we strive to achieve. Before I walk you through today's agenda and introduce you to our guest speakers, just a little bit of housekeeping to make sure we all get the most out of today's webinar. So you'll see that this event is being recorded. We'll make sure that the file is available on our website shortly. You'll also note that at the bottom of your screens there are two icons, chat and Q&A. Please use the chat function to post comments, share your thoughts, offer suggestions on how we might work with you through the index to effect change. Our team will be on hand and following and joining your conversations throughout. And similarly, we've got a small army of policy specialists and researchers behind the scenes, ready and waiting to respond to your questions, live and direct in that Q&A function. So please take full advantage of their extensive knowledge of the index. We will, of course, keep an eye out for any questions that you have for our presenters and our guest speakers, and we'll do our best to get through as many of those as we can. So turning to the agenda then, in a moment I'll hand over to our Director of Policy, Dr. Brien, and our Centre for Metrics Director, Shaun Flanagan, who between them will introduce the index and present some of the key findings. We'll then turn to our guest speakers for their initial thoughts and reflections on the index and a wider discussion about how it might be used by their members and stakeholder groups to drive genuine and lasting prosperity. It's my great pleasure to welcome today Dr. Kerry Healey, President of the Milken Institute for Advancing the American Dream, Pete Peterson, Dean and Senior Fellow at the Davenport Institute, Pepperdine School of Public Policy, and in a slight change to the advertised billing, Neil Bradley. Delighted to have you with us, Neil, Executive Vice President and Chief Policy Officer at the United States Chamber of Commerce. A very warm welcome to you all. So, to business. In a moment, Brien, our Director of Policy, will assess the interconnectedness of prosperity and talk you through some of the features of this year's index. But first, here's a short video to introduce you to the United States Prosperity Index 2020.
The United States Prosperity Index provides a holistic picture of how prosperity was distributed across the 50 states of the Union and Washington, D.C., as well as 829 counties in 8 selected states for the 10 years preceding the coronavirus pandemic. It shows that, prior to COVID-19, US prosperity had been rising and was at its highest ever level. However, prosperity was not equally distributed across the country. Northern states outperformed those in the South, with Massachusetts topping the rankings and Mississippi at the bottom. Prosperity was also distributed very differently within individual states. While some states, like Iowa, saw similar levels of prosperity across all counties, others, like California, had much greater variation and represented a microcosm of the US as a whole. Broadly speaking, urban counties were more prosperous than their rural counterparts, but rural counties were safer and had stronger social networks, while urban counties had better economic performance and social well-being. The growth in America's prosperity was mainly driven by more open economies. Among other factors, states became more productive and improved their fiscal sustainability. For example, Wyoming increased its financial reserves by over 300%, so could survive for 280 days longer by 2020 than 10 years earlier. Living conditions, health, education, and the natural environment had all also improved since 2010. But while the US has seen improvements over the last decade, which can provide a strong foundation as the country charts its way out of the COVID-19 pandemic and grapples with civil unrest, there are warning signs at national, state, and local levels that need to be addressed. The weakening of social capital is a serious threat to future prosperity, as strong and inclusive communities and institutions are the cornerstones of society. Across the US, social networks, trust in institutions, and civic and social participation have all weakened. For example, in Missouri, time spent volunteering fell by almost 1/3, from an average of 37 hours to 26 hours per person. Mental health had also deteriorated significantly in the decade before the pandemic started, and there had been a large rise in the number of suicides and drug overdose deaths, particularly in areas such as West Virginia and Colorado, with Pueblo County especially badly affected. Education had also weakened in the last year, with states such as Alaska, Montana, and North Dakota seeing a decline in test scores for reading, math, and science in the 4th and 8th grades. This is a concern as the pandemic resulted in many school closures, which may exacerbate further decline. Our analysis shows that the key to unlocking greater prosperity lies in the potential for improvement at a state and county level, and not just nationally. By learning from and building upon each other's strengths, every US state and county can further develop inclusive societies, open economies, and empowered people, and drive greater levels of prosperity for all Americans.
Well, welcome everybody. My name is Stephen Brien. I'm the Director of Policy at the Legatum Institute, and thank you, Michael, for that introduction. And to all of those of you who've just experienced some feedback and sound quality, I'd like to apologize. You can do rehearsals 5 times in a row and everything is fine. Then suddenly on the real thing it goes. But we'll keep our fingers crossed for now on a more stable basis. So why would we want to think about prosperity? Well, at the Legatum Institute, as Michael had introduced, our mission is to help create pathways from poverty to prosperity. But what we want to think about is really, what does it take to create an environment where everybody can have a fulfilled life? And you'll have seen through that video snippets of the sort of issues that we've been analyzing and addressing, whether it be quality of social capital, longevity, health of an economy, state fiscal position, and so forth. A wide range of issues. And what we've been working on is an organizing framework that allows that to be measured, whether it be at a national level, a state level, or a local level, at a county level. And through working with experts over the last few years, we have created what you see now on the screen, an organizing framework for prosperity that looks at what we call 3 domains. An inclusive society domain that looks at the quality of institutions, the formal and informal institutions in society. An open economies domain that looks at the business environment, the structure of an economy. And then empowered people domain that focuses on the lived experience. And as we've researched this around the world, we see that for a community, a state, a country to be truly successful, it needs to have all 3 of these areas working in common and in harmony with each other. So let me unpack that just a little bit more. Within each of these domains, we have identified a set of more discrete pillars. So within the inclusive societies domain, we look at safety and security, which encompasses issues such as terrorism, violent crime, property crime. And these 3 areas are what we call elements. These are very, very discrete, measurable aspects of the lived experience or the institutional quality. And then we look at personal freedom. We think about freedom of expression, degree of tolerance, level of discrimination. Governance, we think about rule of law or the government integrity. In social capital, we look at family relationships, social networks, trust, civic participation. So all the different ways in which people can bond together to create stronger communities. And then within economies, we look at the business environment in terms of the level of regulation, labor market flexibility and things like that, market access and infrastructure. We look particularly at communications, transport, energy, water, all the things that are needed to have commerce and trade. And then the economic quality, we focus on degree of dynamism, the number of new companies that are formed, the level of productivity and competitiveness, the level of fiscal sustainability. And then under empowered people, we consider living conditions, which is looking at material well-being, quality of shelter and housing, degree of connectedness. Health, where we look at not only care systems, but also the disease profile, longevity. Education, all the way through the years from pre-K through to tertiary. And then the natural environments, where we consider quality of the atmosphere in terms of pollution, but also level of emissions. By being able to measure all these at different, these levels of pillars and elements, we're able to start not only to provide a sort of DNA fingerprint of a state or a county, but we can also look at the relationships between them. When we think about, is health connected just to the quality of the care system, or is it also connected to the economy, or education, or indeed social capital? So we're able to look at the sort of the social and economic determinants of health. Or likewise, if we think about some of the social tensions over the summer, and ask yourself, well, what's driving that? What's the connection, say, between level of social tolerance, degree of discrimination, but also maybe the quality of government integrity, or the strength of social capital, or indeed even labor force engagement? What are all those different factors that affect people's attitudes towards each other and towards government as a whole? And that's the real power of this index, that it allows you to look at what might be seen as disconnected issues when looking at sort of narrow profiles, but actually are all very connected when you're trying to create a society that allows people to fulfill their lives. So this is the second year that we have produced the United States Prosperity Index. We've updated this year and refreshed the data for 50 states plus DC. We've now produced for 8 states a county level index covering 829 counties. And we've kept this framework, and we've been really lucky to have over 100 experts around the world, 40 of them US based, have helped us get the right framework, a very robust set of data. Now, it must be said, given this has been quite a dramatic year for politics and society, a lot of what we've got measured and captured in this year's index would have been recorded either the back end of last year or early this year. So I think when it comes to considering issues such as COVID or some of the social unrest, this index is very much providing a baseline upon which that happened, as opposed to capturing to this point in time. So we can certainly think of quality of care systems, quality of public health vis-a-vis COVID. We can think about the level of social tolerance vis-a-vis some of the unrest, but we can't capture what's been happening recently. But in doing so, I'd like to pay tribute to the team at the Institute for all the work they've done in pulling together this index. It is a huge exercise every year to gather all the data, to check it, to normalize it, to validate it, to reach out to experts to confirm things. And with that, I'd like to hand over to Shaun Flanagan, Director of the Centre for Metrics, to outline what the index is telling us this year.
Great, thank you very much, Stephen. And can I extend my welcome to everybody? It's great to be with you today. So as Stephen mentioned, what we've done this year is we've updated the state level index from last year. You would have seen this flash up during the video, but just putting it up again, looking at the prosperity of the 50 states of the Union and DC. We see broadly a north-south divide. We see that those states in the north are generally more prosperous in the south, particularly those in the northeast, although not universally so. But as Stephen said, what this identifies is prosperity as the US headed into the pandemic. And what we see on the right-hand side there is really the strengths and weaknesses of each particular state across the 11 pillars prior to COVID-19. But what I want to talk mainly about today is our county level index, which is the inaugural publication of our county level index, looking at how prosperity translates across 8 states and the 829 counties. And what we've done here is we've developed the county level index so that it mirrors the state level index. And we believe this is most useful because it will be able to work hand in hand with the state level index to really inform local solutions as well as statewide solutions. So we've constructed an index which is made up of 132 indicators, of 215 that have county variation, and also 83 indicators, either because they do equally apply to each county, so it could be around state legislation, or it could be that actually we would have liked to have surfaced county level data, but it's just not available. And obviously this is something that we can build on, hopefully, but we still believe it's a very robust index. So we see across these 8 states, what will immediately appear to you is that how prosperity translates across these 8 states is very different. As identified in the video, you have the likes of Iowa, but also Colorado, New York State, where levels of prosperity are broadly similar across each county. So grouping each of the counties into quintiles, we see across those 3 states, prosperity is broadly similar. Now, how it is made up within those 3 states is very different, but overall prosperity is similar. Whereas we look at places like California, but also Texas, Georgia, Montana, we see that we have counties performing very well at the top of the index, but also some weaker counties in the bottom of the index, giving a greater disparity or variation, if you like, across the state. What we do see is a general urban-rural divide, and we'll look at that in a bit more detail. Now that we have county level data, we're able to do that sort of deeper interrogation of the data. But we've also been able to look at what characteristics of prosperity do some of these counties share with other counties and other states. And that's something I'd like to talk through you today. But the first thing I'd like to pick up on the next slide is what Stephen was talking about, the interconnectedness of prosperity. This, we believe, is one of the powers of the index, is really to see how these relationships exist across the different pillars, across the different elements. So when we look at health, and we're looking at the social determinants of health, what this diagram shows is in the inner outer circle, if you like, we see that these pillars have particularly strong relationship with health. So things around education, living conditions, personal freedom, natural environment. As we move to the outer circle, these aspects of prosperity or pillars of prosperity also correlate with health, but less strongly. Nevertheless, they still have a relationship with things that can inform health outcomes. But if we look at the next level down and onto the next slide, if we look at elements, so these are almost sub-pillars, if you like, the 48 policy-focused elements that we've constructed. We've done these because we really believe that these can help inform policymakers' decisions about what needs to be strengthened in the particular area. So I've just chosen 2 examples here, but perhaps come as no surprise. We're looking at the extent to which material resources and physical health relate, and also nutrition and physical health. So material resources, having enough finances, enough income to be able to live a reasonable life to attain well-being. And then on nutrition, having access to good quality food, mixed vegetables or fruit. And we see also obviously that relates to physical health. But these are just a couple of examples to help sort of illustrate what your appetite, if you like, as to what's possible. When we look at the county level index and onto the next slide, what it allows us to do is carry out a deeper interrogation of what is really going on at a sub-state level. So we've been able to look at what is the levels of prosperity across urban and rural and suburban. And it perhaps is no surprise that urban areas are more prosperous. You may have sort of picked that up on the map. But that isn't universally so. We actually see in certain states that some rural counties outperform urban area counties in that state. So if you take Colorado, for example, we find that there's a number of counties in the Rocky Mountains area that actually outperform some of the larger urban counties in the Front Range urban corridor, Pueblo County, for example. But if we go on to the next slide, what this also allows us to do is then also begin to unpack and see how prosperity distributes across urban and rural areas. So I've taken health here as the example. There are 6 elements that make up health, and actually the health pillar in itself comprises 30 indicators. So it's a very comprehensive assessment of health in itself, but then clusters together in prosperity. So these 4 charts show where the biggest differences are across those 6 elements. So if we take the chart on the top left, looking at behavioural risk factors, the higher the prosperity score, the better the performance. And we see here that smoking rates are 4 percentage points higher in rural areas than urban areas, and obesity rates are 8 percentage points higher. These and other differences, such as rates of suicide and drug overdose deaths in rural counties, lead to a vastly different mortality rates, which is what leads on to the longevity. So longevity, we don't measure simply life expectancy. We break down the mortality rates at the different life stages and then add them all up to produce this longevity, because we believe that provides a better sort of direction or framework for policymakers, if you like. But we see some very, very different outcomes in terms of mortality rates. So for example, Milken County in Georgia has a mortality rate of over 8 times that of Eagle County in Colorado for those aged 16 to 64. That's a huge difference. Other area, when you look at mental health, and particularly at the moment with COVID-19, we're obviously very aware that, as illustrated by the video at the beginning, that mental health in the US has deteriorated over the past decade. So where you have areas already, and when we look at perhaps like Montana, it has very poor mental health across a number of its counties. That's obviously a concern as you head into a pandemic, as people worry about their jobs, as people are concerned about their finances, but just generally concerned about the pandemic itself. Mental health is very likely to deteriorate even further. So what is the policy response that needs to take place? So in the other 2 elements on health, whilst we don't necessarily see any particular difference between care systems and preventative interventions, we do actually see some very local challenges. So for example, analysis by the Charters Centre for Rural Health shows that 27% of rural hospitals in Georgia were vulnerable to closure, and 7 of them have closed since 2010. This obviously puts considerable strain on the system, on the health system within that area, and that's been exemplified by Phoebe Putney Memorial Hospital in Albany, which has been particularly hard hit by COVID-19. It has the highest number of deaths per capita in the state found in this region. So finally, I just want to talk a little bit about some other analysis that we did. So what we're able to do with the index, what you could also do with the index is overlay sort of age structure or racial diversity to really see how they differ. What we've done is we've let the data drive the analysis. So we've used the data to cluster together certain types of urban and rural areas, so based on shared characteristics across them. And what we've created for both rural and urban areas are 3 archetypes, or 3 different types of urban and rural areas. And this slide here shows you the rural archetypes that we've created. So you have the Northern Prairie, which is made up mainly of those counties in Montana and Colorado. You have Southern Plains, which is mainly rural Texas. And then you have the Southeastern Coastal Plains, which is mainly rural Georgia. So what we've then done is say, well, what characteristics, what prosperity characteristics do they share in terms of strength? So what strengths do they have? And when we look across these 3 areas, it's perhaps not a surprise that when we look at these rural areas, they all have low levels of crime. Well known that rural areas have lower levels of crime. But then when we also look at areas for improvement, onto the next slide, we see that health features quite heavily, particularly mental health, but also healthcare. Now, this is perhaps important because it helps inform policy solutions across these different areas. But what we also see, actually, is that they have some very distinct characteristics that each of them needs to address. So if we go on to the final slide, when we look at the index itself, when we look at the 50 states and the 829 counties, what we find is each of these face some shared challenges, but they also face challenges that are very distinct and unique to each area. So that's why we've created a comprehensive profile for each state and each county, which looks at their performance across 10 years, across the 3 domains, 11 pillars, 48 policy-focused elements, and 215 indicators. All of this is freely available on our newly dedicated website. So what I've only presented today is a little snippet of what's available, what's possible through the data, through the index at both the state and county level. Now, the website allows you to really interact with and interrogate the data. So, for example, you might not quite agree with our weighting that we've applied on the index. So you can go onto the website, you can actually change the weighting at an element and a pillar level and see what impact it has in terms of the rankings. Maybe particularly useful if you have a strong interest in education, for example. There are also some videos on there that we've done where we're showing how to use the index, particularly case studies around 4 states where we've identified through the index the strengths and weaknesses and where they could learn from or perhaps share with other states their strengths. So to conclude, we are very keen to work with policymakers and others to help them use the index to develop strategies that will improve the lives of local residents and increase their prosperity and rebuild America's prosperity as it emerges from the pandemic so it can emerge even stronger than before from this current pandemic. So with that, I'd just like to say thank you very much for listening. I'll hand back to Michael.
Shaun, thank you. Well, now to my favourite part of the broadcast where we get to hear from our experts, and what a lineup of speakers we have assembled today. Our first guest, joining us live and direct from Massachusetts, is Dr. Kerry Healey, President of the Milken Center for Advancing the American Dream. Kerry's career spans higher education, elected office, and foreign and domestic policy. Last July, she capped 6 years as the first woman president of Babson College, and Kerry previously served as Lieutenant Governor for Massachusetts, where she led bipartisan efforts to improve services for the homeless, tackle the opioid crisis, and increase protections for victims of abuse and violence. Kerry, we're thrilled to have you with us today, and we're really excited by the work of your new centre. Tell me, education's a key measure for the empowered people domain in the US Prosperity Index. With the onset of the COVID pandemic, over 56 million K-12 students and some close to 20 million higher education students have encountered life-altering changes in their learning experiences. What are some of the major challenges you're seeing in the field of education, and what potential growth opportunities are emerging? Oh, Kerry, you're on mute.
You would think that after 7 months of COVID and Zooming, I would have figured that out by now, but you know, always at that moment, as you say. First of all, I just wanted to thank you, Michael and Legatum, for giving me the opportunity to weigh in on this incredible index that you have put together for the US. I have been a long-term admirer of your International Prosperity Index, and so I'm very excited to see the focus, the added focus that you're putting on the US. I'm also particularly excited because as the new president for the Milken Center for Advancing the American Dream, I would have had to put together this index if you didn't. So we're thrilled that you have given us this wonderful starting point, that you've been doing longitudinal comparisons so we can have a sense of actually where we're going to stand next year, you know, when we actually feel and can see the full brunt of this terrible experience we've had with COVID-19 and the economic consequences thereof. You've given us a baseline. You've given us something to look at that gives us some hints of some of the weaknesses that have been revealed over the course of the last 6 months, 7 months, but we were headed in a more positive direction for a number of years. And I have to say also, before I delve into your question about education specifically, which I promised to address, that I am so gratified and pleased to see that Massachusetts holds that position, you know, as number one in prosperity. As the former lieutenant governor in Massachusetts, that means a lot to me, because I think I can give some insight into some of the things that people would need to do, especially, you know, for your empowered people sector, in order to actually accomplish what Massachusetts seems to have done. And unfortunately, the bad news is that it takes a long time. So what we're seeing in education and in the consistent #1 ranking in education in Massachusetts is a bipartisan investment that was made and reforms that were put into place in the early 1990s. And by the governor and the legislature then, they made a decision that Massachusetts was going to be the leader in K-12 education, and they put in extremely high standards at that time and have struggled for 25 years to maintain those standards, to continuously raise those standards, even in trends to slightly lower them nationally. And so I think one has a good case study if you want to look at what it takes to genuinely elevate schools over time and what it means to put in high standards and stick to them, then Massachusetts is a good model. Similarly, Massachusetts led the field under the Romney administration in healthcare reform, and actually predated the Affordable Care Act, and hopefully laid out a blueprint for that. So that means that people in Massachusetts have had 97 to 98% of them have had healthcare insurance in place now for 14 years. And so to imagine that level of healthcare coverage for that period of time, we're reaping the benefits of that in a healthier population and a better educated population. So these things did not happen overnight. I think that what you are also seeing is a governance structure that is consistent, that you've seen a bipartisan effort, although often Massachusetts is unusual because they have all Democratic legislatures and often Republican governors that are very policy focused. And so they work together in a way that has been constructive and consistent over decades to achieve this level of prosperity. So I just wanted to make that note, and I'm always happy to talk about the complexity of how these things fit together in terms of public policy making to anyone who is interested in Massachusetts in particular and their successes over time. At the Milken Institute for Advancing the American Dream, we look at very similar pillars in terms of fulfilling our mission to try to make the American dream an accessible reality to as many people as possible. So we look at education, we look at health, we look at access to capital and free markets, and we look at entrepreneurship and innovation and how that's baked into a culture. So I'm fascinated by your work and excited by it. Back to your question about education. I think that there are three opportunities that are going to present themselves as a result of the devastating consequences of COVID-19 on our students, both K through 12 and in higher education. And first of all, literally 55 million students now are studying online, who were just studying in classrooms face to face. K through 12 at this moment, another almost 20 million are studying now in higher ed, online or in blended learning environments, who were not doing that before. I think that it's important that people understand how few people are either participating purely online though, or purely face-to-face. So only 6% of students right now are purely online in higher education. Only 2.5% are purely face-to-face. So everyone is experimenting with some kind of blended learning. And I think that this is an opportunity for all levels of education to become proficient, for our teachers in our classrooms and our professors at the universities to become proficient in blended learning, because we have a lot of studies, a lot of science behind the fact that that is actually the most effective method for teaching, even more so than pure face-to-face, and certainly much more effective than pure online, especially for those students who have greater needs. So I hope that that is an opportunity for our educators and also our parents to become involved with this blended learning process. The second opportunity that I'd like to focus on is one for public-private partnerships. And I think that this probably is primarily one that we need to focus on at the community college level or the public university level, but I can imagine universities of all kinds reaching out to businesses in their areas in trying to rebuild that connection between business and the skills that people are acquiring, trying to make sure that people are ready for the jobs of the future. The best way to do that and the best way to ensure local employment rebounds is to connect to those job opportunities that are available locally and those employers that are local. So I hope that that happens. And then the third opportunity I'd like to point to is simply a reevaluation of the importance of education and hopefully a greater investment in education by our legislators and by the people who vote for tax focuses, because we suddenly know that we are not teachers. The people who have their children at home realize they cannot educate their children as well as teachers do, or that even if they can, it's not easy. And so I think that for years and years, the appreciation of what a teacher does in the classroom has been greatly undervalued. Just since COVID, the public confidence in our schools has jumped from 29% to 41%. So imagine that. So in terms of building public confidence, trying to step into the shoes of a teacher has built that confidence because people now realize just how hard that is. So I would hope that that would result perhaps in recognizing that value through greater pay, through greater training, and through greater public trust, prestige. So those would be my comments on education.
Kerry, thanks so much. And as the son of a head teacher, I echo those sentiments. We take you now to California and to the Pepperdine University, where we're joined by Dean and Senior Fellow Pete Peterson. Pete is a leading national speaker and writer on issues related to civic participation and the use of technology to make government more responsive and transparent. Pete's been a public affairs fellow at the Hoover Institution, and he serves on leadership councils of the Public Policy Institute of California and California Forward. He's also on the board of the Homeland Security Advisory Council. Great to have you with us, Pete. You've been doing some work on the impacts of loneliness in the United States. How does the report's Inclusive Societies pillar align or not with this research? And how do you see it influencing the broader subject of prosperity?
Thank you, Michael. And I'll just echo Dr. Healey's appreciation of this work. Not only is it expansive in scope, but it's the telescope and the microscope at the same time. The ability to drill down geographically is extremely helpful to someone like myself who does a fair amount of work in not only California state policy, but even regionally. As the report points out, there's so much difference in regions, particularly here in California. Sometimes we're known as 7 different states all rolled into one. In fact, there have been some ballot initiatives to try to actually instantiate that into law, but suffice it to say, we are a very diverse state with very diverse challenges, and this report is extremely helpful there. We do here at the Graduate Policy School have been taking on this issue of loneliness, and I have to say it wasn't something we did intentionally. It's part of an initiative here at the graduate school called the American Project. We began with gathering think tank policy researchers and activists here to our Malibu campus to look at what are some of the causes of our political polarization. And although we thought that there were going to be political causes, we resolved on the cause being much more cultural, and that being this issue of loneliness, which is one, when we first landed on it about 2.5 years ago, was just beginning to, I think, come into the broader public discussion. But now it seems that everywhere you turn, there's a new research piece, policy analysis, or even government policy program that's meant to address this issue. It's one that cuts across disciplines, from economics to political science to social psychology. Certainly one that's being analyzed in public policy spheres. I'd note that this is not just an American issue, but I think one that's actually one of the Western world. I note that you all there in the UK have created a minister of loneliness. So this is one that we are taking very seriously, and your report definitely aligns with this. I have to say that both at the national level, when you look across the pillars, every single one from 2010 to 2020 is in at least a slightly positive, if not very positive trajectory. But when you look at this area in inclusive societies, even within that policy domain, you still see continuing fairly positive results here in the United States until you get to social capital. And that's not only true of the United States, it's also true of California. And so when we drill down into the California statewide report, we also saw that it was the one indicator out of all the indicators that actually declined over the last 10 years. And so when you look at the specifics within that pillar, we're talking about issues like social networks, institutional trust and agency. And in all of those, we are seeing declines across the board, not only here in the United States, but also specifically here in California. In fact, in each one of those, I guess you might call them sub-pillars, I think that was one of the terms used before, California ranks in the 40s in each one of those sub-pillar areas within social capital. And so in some ways, I take this term that's variously called loneliness or alienation as a way of capturing all those elements in social capital. And I know when we had an earlier conversation about the statewide report, we discussed Robert Putnam's important research around social capital, not just bowling alone, upon which we're about to hit the 20th anniversary of that groundbreaking book, but some research that he did back in 2005, 2006 for a journal article, research he called E Pluribus Unum, in which he examined civic trust and social capital in 41 American cities. And he found rather disturbingly that in each one of those cities, there was an inverse relationship between levels of ethnic diversity and civic trust. So in measures like helping of neighbor, civic participation, trust in one's neighbor, whenever there were great levels of ethnic diversity, there were low levels of civic trust, except for two places. Large Protestant mega churches and large Catholic churches were the only two places across America in these 41 cities in which there were high degrees of ethnic diversity and high degrees of civic trust. And so, again, I think important for this concept of flourishing is how we connect with one another. And the specific issue of social capital, I couldn't be happier that you're exploring and quantifying, because I think it really does drive a whole host of public policy as well as civic engagement opportunities here, not only for the United States, which is legendary, to go back to Tocquevillian descriptions back in the 1830s about what we do in civil society, but obviously we have some challenges ahead of us, ones that were revealed even before the current pandemic.
Pete, thank you so much. We head to DC now, where we're joined by Neil Bradley, the Executive Vice President and Chief Policy Officer at the US Chamber of Commerce. An equally impressive CV, Neil spent 2 decades working directly with the congressional committee chairs and other high-ranking policymakers to achieve policy solutions. At the Chamber, he's responsible for aligning the organisation's overall policy priorities and advocacy efforts. And he oversees several major policy divisions, including on economic policy, employment, health, and environmental affairs and sustainability. So Neil, a wealth of public policy experience across the full spectrum of society. That said, the US Chamber is seen and known as a national business association. Do you consider prosperity on a purely national and essentially economic basis, or do you think about it more broadly?
Well, we tend to think about it more broadly, Michael, and that's why I was so excited to participate in this program today. As I think you increasingly see from business leaders across the United States, it's a realization that the interconnectedness that you all talk about in your report isn't just kind of an academic matter, it's a real life matter on the ground. And so when we talk to our CEOs, major C-suite corporate leaders who are part of the chamber, we increasingly spend time talking about the state of American education. We spend time talking about healthcare and the health of their employees. We talk about transportation, but not just in the old way of getting goods from where they're produced to market, but how their employees get from home to work. Increasingly, we're talking about affordability of housing, because all of these things factor into their ability to run a company, to have successful employees, and ultimately to be successful overall. So this interconnectedness isn't just for the nation, it really is interconnectedness for our companies as well. And that's why the breadth of the issues that we work on at the Chamber is continuing to expand. You know, Pete mentioned civic trust. You know, at the core of civic trust is not just trust in our institutions of government and our fellow citizens, it's also trust in this overall system and our system of free enterprise and our capitalist system. And if that trust begins to break down because we're seen as incapable of solving what are very real problems on a very localized level, then people begin to look at other systems and they begin to question the ability of the system itself to respond to problems, which is why looking at this at a localized level is really important. You know, if there's one thing that maybe the pandemic has put a spotlight on, is that that national statistics rarely tell much of a story at all about what's happening in real people's lives. Frankly, state level statistics often don't do a very good job of talking about what's happening in real people's lives. You really have to get to that local level to understand that today, even in the midst of this recovery, we have industries, we have cities who have essentially fully recovered economically. Employment is back, given the makeup of their employment structure, or their industry that they're in, where it's essentially returned to where it was in February. We have other parts of the economy that are experiencing devastating losses. And while this is true in the pandemic, it was also true before. Whether you're looking at venture capital investment in the United States, or job creation, or new business starts, they tended over the last couple of decades to become highly concentrated in very specific locales. And that masked nationally the despair that was occurring, or the stagnation that was occurring in other areas. And so being able to think about this locally helps us figure out how to think about the policy locally. So at the US Chamber, for example, we've started, even though we're a national organization, we have state and local chambers, 3,000 of them all across the United States, who are our members. And we're talking about with them about local solutions that can be supported at the federal level. Opportunity zones, for example, of a way of addressing investment into communities that frankly have seen way too little investment. Kerry mentioned targeting education and job training to local employers. One of the ways we found is we spent decades talking about national employment trends. Well, who cares about national employment trends? I care about the employment trend in my neighborhood because I don't want to have to move, or at least I want to know if I'm going to have to move to get a job. And so we've launched programs like Talent Pipeline Management that are designed to do what Kerry described, which is connect employers with educators, with the public officials, and say, what we ought to do is design a system that works for our neighborhood. And we've become more and more convinced that that's the only way we're going to tackle big problems. You know, lastly, this summer has kind of brought to the forefront the divide and the equality of opportunity in this nation. And I know it's something that your report gets into, but I think it's something we can focus even more on in future editions, because closing that equality of opportunity gap really can only be done on a localized basis. We can only address these challenges if we address them holistically in local neighborhoods, where we don't just bring in and deal with job opportunities and investment for entrepreneurs, but we also deal with the educational system, the health systems, the social destruction, the family disorientation that's going on. And only if we're willing to tackle all of those are we ultimately going to be successful. So that's why I commend you for the work that you're doing. I know our chambers at the state and local level, as well as the US Chamber, will find it immensely beneficial as we try to tackle these problems. And Michael, you're on mute now.
See, it happens to us all. At this point, I'll bring Shaun back in now, and we can have a wider discussion as a group and discuss some of the key themes in more detail. Stephen, if I may hand over to you, and you can sort of guide us through that.
Great, thank you, thanks. Well, thank you, Kerry, Pete, and Neil, for those comments. Maybe what I'd like to do is just pick up, Neil, on that last point that you made and turn it over to Shaun. Neil, you talked about equality of opportunity and some of the challenges of making sure that in diverse communities, everybody gets access to that. And Shaun, one of the criticisms of the challenge of the index so far is that we haven't really been able to get to the bottom of outcome differentials, whether by ethnicity or by other minority groupings. So you perhaps talk to that and what you think the way forward might be.
Yeah, absolutely, very happy to. So we would, in constructing this index, we built it from 215 indicators. And I think one of the challenges, one of the things we'd like to have been able to do is to provide more of socioeconomic disaggregation of the index. one of the challenges is that we find that the holistic data sets just don't really exist. You don't really find comprehensively data sets on education by ethnic diversity, for example, particularly at county level. I mean, even at state level, I think some of this is challenging to get hold of. So while some states actually produce data for their own state, getting a comprehensive assessment across all states and counties is quite challenging. But what is possible with the index is to be able to align it, as we've shown, with other socio-economic factors, to be able to see how they align with the index, to be able to understand, you know, what particular aspects of prosperity are weaker, perhaps in those communities or areas. So there are some things, but I think our call is hopefully that over time, that these data sets will become available to allow us to incorporate them into the index.
Thanks, thank you, thanks. Peter, I'm just picking up from the Q&A. There was a question around mental health, and particularly I think picking up on the observation that Shaun made about how the mental health for rural communities is poorer than for urban communities. Now, I'm just wondering whether, from the perspective of your loneliness study, you know, the questioner was asking, is this purely an economic thing, or is it about a way of life? And I was wondering whether, from your work on loneliness, you see any urban-rural divides there that might shed light on that.
We haven't seen that, but I think this would be a fascinating lens to look at this through. Of course, there's a chicken or the egg type of challenge with this too, and at least some of the research that I'm seeing is that these public health challenges around loneliness, which there certainly is a mental health component, are being brought about by the alienation or disconnection itself. That then exacerbates itself, and you start getting into this really perilous cycle. But there really is a public health challenge which has a mental health component as part of these discussions around loneliness. I know several people, social psychologists, that are looking into some of these issues as well. The most recent in the Obama administration, Surgeon General Vivek Murtha has made it this his #1 health issue is the implications of loneliness to health, both mental and even physical.
And if I could jump in there and add a bit on, I'm very concerned about the closure of schools, given the broad array of services that they contribute to the communities in which they operate, especially in poorer communities. And so some 15% of students, I believe high school students and middle school students, had received some kind of mental health counseling or support through their school before. Obviously, if schools aren't in session, that's not happening. There are millions of students, at least 15 million, who receive more than 2/3 of their daily nutrition at their schools. And again, if their schools are closed, where are these calories coming from? Are they as healthy as they would be otherwise? So there's a big impact on not only the economic welfare, but the psychological welfare of communities when schools are closed.
Thank you. Yeah. And I'm just wondering from your perspective, Neil, with respect to schools and education, as your members look forward to the next couple of years, a sort of intake of new hires, how are they adapting to the likely situation that people are going to be coming through with maybe less clear grades, having missed education? What's the business agenda here to close that gap?
This was a big problem before any of us had ever heard of COVID, right? So if you talk to our members 9 months ago, they would have told you that they did not feel, even whether they were employing college graduates or community college graduates or high school graduates, that they were concerned that the skills that graduates were leaving with didn't match the skills that were necessary for employment, both on a hard skill side, but increasingly also, particularly as we're talking about high school graduates, on a soft skill side. Just that basic preparation to transition from education to workforce. Certainly the current dynamic where we've disaggregated the social interaction that schools create is only going to make that worse. And so we think about it from exacerbating those problems, but also the potential for lost learning. And if that lost learning compounds over time, this is a problem that we might not see next year or the following year. It's a problem we might be experiencing 5, 7, 10 years from now. You know, Kerry talked about how they reformed the schools in Massachusetts in the 90s, and they're receiving the benefits of that today. Well, if we're moving backwards nationally today, we're going to face the consequences of that 10, 15 years from now.
Yeah. So, Pete, if we look at California, I think one thing we identified when we looked at Education California is that there's a very different story for the kids who grow up in California versus those who come to higher education. I mean, you're, an alumnus of Stanford, the Hoover Institution, but Stanford and others will gather people from all around the country and educate them. And then California's education statistics look really good. But if you're a kid growing up 15 miles away from Stanford, your prospects are quite different from those statistics. And as somebody who's been involved in local public policy, what's the way around that? How are you, collectively within California addressing that issue?
No, it's a great point. I think that the challenges that California faces, especially around K-12, are both political and policy based. Some may be familiar with the tax revolt back in the 1970s which resulted in Proposition 13, which had many benefits for property taxes and keeping especially the elderly in their homes. The downside of that was that it centrally governed all of the tax revenues away from local school districts to the state. And with that became a centralization of education policy that I don't think has really benefited most Californians. At the same time, the state has been politically very averse to school reform measures, whether we're talking about charter schools or school choice more broadly. The teachers' unions, the public teachers' unions here are extremely powerful politically. And so I don't think we're going to realize our potential of our K-12 system. We essentially have school choice at the college level, right? You can go to Stanford, or you can go, if you can get in, you can go to these places. We don't have that school choice at the K-12 level. And unless and until we start making those decisions politically and from a policy standpoint, we're not going to match the success of our higher education system.
Okay, thank you. I'm looking at the clock, and I know that Michael is going to turn me down fairly quickly. So maybe just quick last comment from Kerry and Neil in terms of your observations of what the index can do, and maybe the potential for its further use. Kerry.
Yeah. Well, first of all, I think that right now it can be a benchmark, and we can now be able to, unfortunately, measure the devastation that's going to occur to our society across all of these metrics in the coming year, and we can begin to build back. So, while I'm not excited to see what comes next year in this index, you have performed an incredibly important function by drawing that line and helping us to understand more granularly what we need to do.
Yeah. Neil?
I would say the same, and then it has the added benefit in the communities where you've been able to do this county level work, an opportunity to really spark deep conversations that are data driven, that, let's face it, sometimes are not comfortable discussions to have, but if we're going to make progress, are really important discussions to have.
Great. Well, thank you all three. We look forward to having those conversations. Michael, over to you.
Thanks very much, Stephen, and thank you once again to our guest speakers, Neil Bradley, Pete Peterson, and Dr. Kerry Murphy-Healey. I sense that we're going to hear a lot about the American dream between now and the November elections, but the truth is that enabling people to realise that dream isn't just the responsibility of government and politicians. Whether we're policymakers and influencers, researchers and academics, investors and business leaders, community organisers or philanthropists, it's in all our gift to ensure that opportunity is equally available to everyone, and that you can achieve your goals and advance that dream no matter who you are or where you live. We invite you please to use the United States Prosperity Index, the freely available findings, the analysis and the raw data sets, and work across states and sectors to develop clear and achievable roadmaps that will deliver strong and stable institutions and real and lasting economic and social well-being for all Americans. Please don't hesitate to get in touch with us if you have any specific questions, or better still, if you'd like to explore ways to collaborate with us to improve the nation's prosperity. We're well versed and work regularly across the globe, bringing together experts and policymakers to help them understand the challenges, to share the implementation experiences, and ultimately to formulate policies that will really make a positive difference to people's lives. We'd love to work with you in any way that's helpful to drive concrete improvements and leave a positive, lasting legacy in the wake of this pandemic. Thank you so much once again for joining our event today, for marking the launch of our United States Prosperity Index 2020. From all of us at the Legatum Institute, a very good afternoon.